So let's talk some more about this with two doctors who are on the front lines of this fight, not just against influenza, but other respiratory viruses that are circulating. Dr. Joanne Langley is a pediatric infectious disease physician at IWK Health Centre in Halifax. And Dr. Sauve is a pediatrician in Vancouver and also the chair of the Infectious Diseases and Immunization Committee for the Canadian Pediatric Society. Dr. Langley, let's talk about the flu vaccine, because there's been a fairly low uptake for that. What are you hearing from hesitant parents?
So the flu vaccine has been recommended for children for about a decade as an annual vaccination. And even though that has been recommended, the uptake, even prior to COVID, was not as high as we would like. And the most common reason we've found in surveys is that parents don't think that influenza is a really serious illness for them. And they perhaps haven't had a chance to have a conversation, a heart-to-heart with a healthcare provider who explains what can happen if you get influenza and shares the benefits and safety of the influenza vaccine. So we're seeing that often in children that are sick enough to get admitted, that parents didn't have time this year to get influenza vaccination or didn't know how important it was to get the vaccine.
And so, Dr. Sauve, let's pick up on that message. I mean, every doctor I've spoken to says the flu vaccine is effective, particularly this year, that it is safe, and that kids in particular and older people should have it. So how do you deal with hesitancy on the part of parents? What do you say to them?
Well, one of the things that I've heard parents say to me frequently is that when they got a flu vaccine in a previous year, their child or their child still got a viral illness. And so I often spend some time talking about the fact that influenza is one of many viral illnesses, and the influenza vaccine only prevents influenza. It doesn't prevent RSV or parainfluenza or any of the other viruses. So we would still expect that kids would get colds after they've had the influenza vaccine, but the influenza itself is much more serious than people realize, that it can often lead to people feeling really terrible for a week or more, but also it's an important cause of hospitalization, particularly in kids younger than 5 and in elders older than 65. And for me, I think we should do everything we can to prevent these severe cases of influenza.
And Dr. Langley, I probably don't have to tell you, lots of theories floating around there about why we're seeing these spikes in RSV and right now the flu. But from your perspective, what's the reason for that?
So if we look at what the effect of the pandemic has been, the COVID-19 pandemic, you'll recall we all went into our homes. The only virus that was circulating predominantly was the COVID-19 virus, SARS-CoV-2. And so parents weren't exposed, neither were young children. So that happens with every pandemic, that the natural viruses patterns, the epidemiology switches and may not get back to normal for a couple of years. So we're going through that now, where we have children who are in their first year of life and their second year of life, and some in their third year of life, who've never been exposed to flu or RSV or many of these common viruses. Plus, their mums weren't exposed, so they didn't pass on antibody to those young babies. And all of our immunization programs were disrupted during the COVID-19 pandemic because people couldn't get access to their healthcare provider. And so many things are happening at the same time that have, I think, caused this much earlier surge of influenza and more cases than we would usually get, even in a regular year.
And Dr. Sauve, just 30 seconds left, but for parents out there who are nervous about what's happening and don't want their kids to get any sicker than they have to, besides getting the flu shot, what else would you advise?
Well, it's really the same layers of protection that we've been talking about through the whole pandemic, making sure that we all do our best to stay home when we're sick, making sure that we're washing our hands lots. That's an important driver of many respiratory viruses. And then when we're in crowded indoor spaces, making sure that we wear a mask. If we use those layers of protection, and particularly stay home when we're sick, I think we'll do well at protecting ourselves.
I know it's tough out there in the hospitals and for a lot of families and for healthcare workers, and really appreciate you taking some time with us tonight. Thank you.
Thank you.
Thank you very much.